we have Dr. Deboja MAHASHWETA. She will be basically talking on Fundus Fluorescein Angiography.
Good afternoon, everyone. So let's begin with fundus fluorescein angiography and its relevance today. Fundus fluorescein angiography, or FFA, is an invasive diagnostic procedure which helps us to assess the physiology, pathology of retinal circulation mostly. Its clinical use in ophthalmology was first developed and discovered by Harold Novotny and David Elvis in the year 1961. It basically involves intravenous injection of a dye, sodium fluorescein, followed by the acquisition of serial fundal photographs. So sodium fluorescein dye has the property that it cannot diffuse through intact retinal endothelium and retinal pigment epithelium. However, it can diffuse very easily through choriocapillaries, and these properties are used for diagnosing and detecting various retinal conditions. So about purpose of FFA. FFA investigates the status of retinal circulation. So it tells us the presence of any non-perfused areas, any microvascular abnormalities, and neovascularization. Also, it tells us whether there is any disruption of the retinal pigment epithelium, which is shown as a transmission defect or a window defect. It also checks the integrity of the blood-retinal barrier, both the inner and the outer. Briefly about fluorescence. Fluorescence is the luminescence which is maintained only by continuous excitation. As soon as the excitation stops, the fluorescence also stops. So excitation occurs at a particular wavelength, that is somewhere around 465 to 490, which is the blue light, and then emission occurs at a longer wavelength, which is 510 to 530 wavelength, which is the green light. So this shows the photographic principle of fluorescein. So the camera flashes white light, which passes through the blue filter. This blue filter excites the fluorescent dye, which is there in the retinal circulation. And the light again comes back and it falls on the yellow-green filter, which cuts down the blue light and lets only the green light pass, and then it falls again on the camera and the pictures are acquired. So the various indications are various retinal vascular conditions, macular disorders, retinal vascular malformations, tumors, and other optic nerve diseases. Contraindication, absolute contraindication would be if there has been a history of adverse reaction to FFA before, or if the person is allergic to any iodine-containing compounds. Relative indications are, contraindications are asthma, renal failure, hepatic failure, and pregnancy especially should be avoided in the first trimester. The various equipments required are, of course, the fundus camera with a digital imaging system along with the correct barrier filters, sodium fluorescein dye, 5 ml syringe, cannula, tourniquet, alcohol swab, and along with all that, we should be ready with a standard emergency setup to manage the anaphylaxis. And these are some of the drugs along with IV fluid suction equipments which should always be there near the wherever we are doing the fundus fluorescein angiography. Though anaphylaxis is very rare, seen in the overall incidence is somewhere around 0.08 to 0.3%, but in one odd case, if these drugs are there, it could be life-saving also. So for patient preparation, first of all, informed consent is a must, along with good pupillary dilatation. Then we have to prepare the dye, take the dye. Patient should be comfortably seated. We prefer the antecubital vein, and so the hand should be rested well. Alignment and focusing of the camera. First of all, the color image is taken, and after the dye is injected, the red-free images are captured. Interpretation of FFA. So normal fluorescein angiogram consists of the following overlapping phases. So if we consider the retinal vasculature, so from ophthalmic artery, it gives two branches, the posterior ciliary artery and the central retinal artery. Now the posterior ciliary artery is the proximal branch, and so the dye enters around 1 second earlier in the choroidal circulation, and then it comes to the retinal circulation, and therefore we get a choroidal flush first, which is followed by arterial, arteriovenous, venous, and a late elimination phase. The picture here depicts the same. So first of all, there is the choroidal phase where the choroidal flush can be seen, followed by the arterial phase where the arteries are filling. In the arteriovenous phase, the arterioles, the capillaries, and the post-capillary venules start to fill, and we can see a laminar flow in the veins as well, which is followed by an early venous phase where still the veins are filled. By mid-venous phase, the veins are almost completely filled, and in the late venous phase, we see that the arteries are starting to empty. And then comes the recirculation phase, where the dye concentration starts reducing from the vessels, and a complete emptying occurs at around 10 minutes. In this phase, staining of the optic disc, Bruch's membrane, choroid, and sclera can be seen. So there are certain terminologies which are relevant for the FFA for describing an FFA image. Hyperfluorescence and hypofluorescence. Hyperfluorescence is an area of bright white area in the image, and hypofluorescence is a dark area in the image. Hyperfluorescence can again be seen either after injection, or it can be seen in pre-injection also. And the pre-injection fluorescence could be autofluorescence and pseudofluorescence. Other could be transmitted fluorescence, leak, pooling, and stain, as we will see the examples later. Hypofluorescence is seen as blocked fluorescence or as vascular filling defect. Autofluorescence. Examples could be optic disc drusen or a retinal astrocytic hematoma. So autofluorescence occurs because there are certain biological structures which have a property of fluorescing because of the contents in their microstructure, like porphyrins or lipofuscin, which can fluoresce even in the absence of the dye. Next is a transmission defect or a window defect. It is basically seen due to the atrophy of the RPE, the background choroidal flush is seen. So it appears early and it peaks also early in the phase. And there is no increase in size or shape as seen in geographic atrophy. Next is leak. It is also a hyperfluorescence where there is increase in size as well as intensity over a period of time, and the leakage is seen in a potential space as seen in CNVM. Also, it can be seen where there is neovascularization at the disc or elsewhere, and seen in cystoid macular edema. As we can see with the phases, the intensity is deepening. Next is pooling, hyperfluorescence with same size but increase in intensity. The collection of dye is there in a defined anatomic space, as seen in retinal pigment epithelial detachment and in central serous retinopathy. Next, staining. So sometimes there is retention of dye with hyperfluorescence at a later stage, as seen with drusens and with various scars. Now let's come to hypofluorescence, where there could be blocked fluorescence. Blocked fluorescence is basically if there is something anterior to the circulation which is blocking the visibility, and it needs a clinical correlation with the color picture as well. Or there could be vascular filling defect because of non-perfused areas. So these are some of the FFA images which could be seen in a case of diabetic retinopathy. There could be hypofluorescence because of blocked fluorescence. There could be leakage, deepening of the leakage as seen in a diffuse macular edema. There could be cystoid macular edema. Then because of NVDs and NVEs, there could be leakage, and then could be macular ischemia. And similarly, certain pictures showing a retinal vascular occlusion. Now let's come to the limitation of FFA. So FFA has limited ability to image the choroidal circulation, and of course it is associated with some serious adverse reactions, and it is not able to obtain angiograms in a patient where there is excess of hemoglobin or serum proteins. However, FFA is still relevant today as a key diagnostic tool because it gives a detailed picture of the vasculature of the retina and helps in diagnosing various retinal conditions. Although there has been, with the advent of various other newer modalities, they show various anatomical details, but FFA is still key to know about the vascular permeability, leakage, and non-perfusion areas, which are critical for diagnosis, treatment planning, as well as monitoring the disease progression. Again, it is also important for diagnosis of some specific conditions like CSCR. It can be beautifully diagnosed with that. Then also for planning treatment in active vasculitis cases. And again, accessibility and cost effectiveness is also a factor to be considered. Thank you.